Hi everyone, Dr. Geldart here at Assistant Associates. Today I just want to do a quick review of a really common condition that we've all heard of, type 2 diabetes. So what is type 2 diabetes? Well, type 2 diabetes differs from type 1 diabetes in that type 2 diabetes is considered a lifestyle diabetes. So what does this mean? A lifestyle diabetes is basically one that's acquired. Okay? So that means it's acquired through choices we make. Nutrition, sedentary type behavior, things like that. There is a genetic component to it as well. However, lifestyle choices can help decrease the risk of acquiring it. So what is type 2 diabetes? Well, up here on the board, I have a nice little illustration that kind of depicts roughly what happens. Now, this isn't based upon actual pictures from textbooks or anything like that. This is more just to help people understand how it works. So right here we have blood vessels, and right here we have muscle cells. So with type 2 diabetes, what kind of happens is we have our organ here, the pancreas. The pancreas is responsible for producing what we call insulin. Insulin is a hormone. What insulin does is it binds to these little cells right here. They're called receptors. When it does that, what it'll do is it'll collect sugar that's floating around in your blood and it'll bring it into the cells. It brings it into the cells in order to satisfy the cell's resting activity kind of going on. The cell needs nutrients, and the nutrients come in the form of sugar. However, what tends to happen when you eat too much sugar or you just have a poor diet, let's say, built on a lot of carbs, for example, simple carbs. What the pancreas will start to do is it starts recognizing all the sugar building up in the bloodstream. So what does it do? It starts to produce more insulin. Well, when this happens, eventually the body stops responding to insulin, oddly enough. Therefore, the shuttle, to get the glucose or the sugar into the cells, it starts disappearing. And thus, the cells don't really get the nutrients they need. When this happens, you'll start to experience different side effects. Now, having one of these isn't a huge ordeal, but if you experience a bunch of these, that's something worth getting checked out. Okay? So one of the big ones is cravings. Why cravings? Well, if you think about what's going on in the cells, right? They're not getting what they need anymore, that being the sugar, right? So the sugar starts disappearing, thus the cells are hungry, right? So it starts craving sugary foods, like chips, ice cream, things like that, things that aren't good for us. It starts causing excessive thirst. Why does it do that? Well, the body wants to get all this sugar out of the system, because too much sugar in the system, it doesn't make you feel good overall. So the body wants to eliminate the sugar through frequent trips to the bathroom or by drinking more water. Lastly, chronic fatigue. So as you can imagine, if you have no sugar in here, the cells eventually have a tough time working properly. And so thus, you start to experience fatigue because they aren't getting the nutrients that they need. So this is a quick, just overall lesson on type 2 diabetes. I hope that helps you understand the mechanisms and also some of the side effects that go along with it and why.